As Women's History Month comes to a close, we're talking about the importance of women's health care in this week's Healthwatch 16 report.
Newswatch 16's Emily Kress spoke with an OBGYN at UPMC about misconceptions about seeing an OBGYN.
Healthwatch 16 is sponsored by UPMC, life-changing medicine.
With technology at our fingertips, it can be information overload. Dr. Angela Hugler is the medical director of obstetrics and gynecology at UPMC. She says while knowledge is power, not everything online is helpful when it comes to your health.
It's hard because a lot of patients will come in to discuss a certain aspect of their health, but they have a preconceived idea or something that they've read about or found that might not be a very reliable source or very good data.
She says one concern among patients is that the pelvic exam is painful, especially when it involves a pap smear. She says there are ways providers can make it less uncomfortable for patients, since it is a vital part of checking overall health in the reproductive system.
We are trying to find abnormalities before it would be symptomatic to the woman and to prevent her from having any potential complications down the road that we weren't able to identify earlier.
Another misconception is that OBGYNs are only needed when you're pregnant. Dr. Hugler explains there are lots of things an OBGYN can take care of, including STD screenings, immunizations, and other preventative care.
And I think a lot of women now are hearing maybe my pap smear isn't due yearly, and then they think that means an exam isn't due yearly, but it is. We are still looking for other potential problems that would include a breast exam for breast cancer screening.
When it comes to contraception, doctors say there are many options, from pills to IUDs to prevent pregnancy. Birth control can also be used to manage other conditions, but what works for one patient may not be the best for another. Dr. Hugler says one major concern she hears from patients is that long-term use of birth control leads to infertility.
Some do get out of your system, so to speak, a little faster and allow return to fertility a little quicker than others, but none of them are associated with a long-term risk of infertility.
Officials with UPMC say when in doubt, schedule an appointment with your provider. In this Healthwatch 16 report, Emily Kress, Newswatch 16.